My name's Gay Hawksworth and I'm the Secretary of the Queensland Nurses Union. Aged care in Australia is at crisis point. The increasing wages gap, excessive nursing workloads and the Howard government's unfair IR laws are driving aged care nurses from the profession. Alarmingly, nurses working in aged care in Queensland earn on average $150 a week for RNs and $94 a week for ENs, less than their nurse. For the past 10 years, Mr Howard has looked on as his funding policies have left aged care nurses the lowest paid in the country. Now his unfair IR laws will put them even further behind. As much as aged care nurses hate leaving, without fair wages and working conditions, they will not stay. This month, however, we can do something about it. On November the 24th, Federal Election Day, the QNU wants to show that aged care nurses are not alone as we call for fairer wages and conditions, help close the wages gap in aged care and get rid of the IR laws which leave aged care nurses even further behind. This federal election, vote to save aged care nurses.
My name is Cheryl Doran. I've been an endorsed enrolled nurse and I've worked in aged care for 38 years.
38 years, that's quite some time. What do you think are the problems then facing aged care workers in Australia?
In aged care today, it's certainly reached crisis point. We now have less nurses in aged care, the acuity of our resident is far greater, and we're actually being asked to do more with less.
So given that, what are some of the negative changes you've seen in aged care over that time?
Over my 38 years, gosh, where do you start? I guess back when I started, certainly we didn't have penalty rates and we didn't have shift allowances. With each change in our wages structure, when we got a wage increase, we got shift allowances, penalty rates, the number of staff were reduced to counter that. So consequently, the quality of care that we were able to give was reduced too. If I can give you an example of what it's like back in the bad old days, and they're not that far gone because it was back in the 70s. Our residents, when I first started the nursing home where I worked, our residents was a mixture of what we now call high and low care. And because we had dementias all mixed in with that as well. Patients they were called then because it was more of a sort of a medical model, but they wore their own clothes. We had heaps of time to keep them mobilised, to take them for walks in the garden. We were able to look after them really nicely and give them quality time. With each wage increase and the reduction in nursing hours, they were reduced back to having showers at 3 in the morning by the night staff, and then we'd sat out of bed from that time on. They were put into night attire all day. They were sat in chairs and tied into those chairs with calico binders, which incidentally the night staff used to make while they were on night duty. Their nighties were put up around their waists. Their dressing gowns were put on back to front, so that reduction in laundry and all that sort of stuff. Horrendous, and we actually had to fight, and we fought through the Nurses Union to get those conditions back for our residents.
So essentially you're saying some conditions have improved over time. Are there other conditions that might have worsened?
The workload of the nurses in aged care is certainly worsened because with the acuity of your resident you've got, with the less nursing staff that we have on, greater number of residents as well, it's just go.
According to QNU research, in Queensland on average, RNs working in aged care facilities get paid $150 a week less, and ENs get paid $94 a week less than those in the public sector. What effect do these comparatively low wages have on the aged care industry and on your work?
It means that you have great difficulty in attracting RNs to the workplace, particularly RNs to the workplace. You also have difficulty in attracting endorsed enrolled nurses because they have far greater options of where they can work. It then means that there is an imbalance of skills mixture, so that you have, I'm an endorsed enrolled nurse. On a shift, I'm the one that's basically in charge of my community of 28 residents, plus I have the nursing staff to manage as well. I also have doctors, pharmacy staff, all that sort of stuff. So, and then there's an RN who's on the premises who I can call over if I need her. But ideally, there should be an RN on as well.
So you say that the sector's having difficulty attracting RNs. We also know that nurses are leaving the profession. So who's to blame for nurses leaving aged care?
Well, aged care is funded by the federal government, so certainly the buck stops there with them. In aged care now, there is no accountability for how funding is spent. It's given to the providers, they spend it as they like. I mean, certainly my experience going back is that there was a far better system in place where there was a dedicated funding just for nursing and personal care. I personally believe we should go back to some sort of a system of that, where there is transparency of where money is spent and where there is accountability for how it is spent, and that, if you have that dedicated amount of money for nursing and personal care, then you can start to look at giving quality care to the residents.
How about the Howard Government's industrial relations laws? Do you think that that's having an impact on nurses leaving aged care?
It certainly is, and if Howard gets back in, well, then it will be worse. At the moment, there's aged care comes under the federal system. There are certainly some employers who are still choosing to go through the collective bargaining system, but there are also those who are choosing to come under work choices. So it leaves insecurity of tenure for the nurses. It means that they're forever in doubt as to whether they can continue having their penalty rates or their shift allowances, all those things that make boost their pay so they can afford their mortgages. It also means that if at any time, if Howard does get back in, I'm quite sure that work choices will be tied in with funding. So providers, without doubt, will be told you will not get funding unless you come under work choices.
So if the Howard Government is voted in again, is there a concern among aged care nurses that more nurses will leave the profession?
There certainly is, because let's face it, most nurses now, they're used to penalty rates, they're used to their shift allowances, they base their whole budget on that. That would be a huge gap in their family budgets.
So what would you say to perhaps other nurses who aren't working in the aged care sector when they're thinking about who they're going to vote for this election?
Well, I think that no nurse working in any sector is exempt from work choices or the Howard Government's plans further on down the track. So I think everyone has to be extremely careful of how they vote this time. If I can give them some advice, I would certainly say whatever you do, put the coalition members last. How you vote further up the track is important too, because if you're planning on voting for a minor party, you have to be extremely careful of where your preferences go. You may well feel that you're voting for someone on a minor party, an independent or a Green or a Democrat perhaps, but if they are preferencing to coalition, then your vote is for work choices.
So why is the Your Rights at Work campaign then that the QNU is running at the moment, why is that so important and why are you so passionate about it?
I'm important because at the end of the day, I'm a nurse and I really care about my residents in aged care. Public sector nurses really care about their patients that they're caring for, and we want the best for them, and we can't have the best for them unless, first off, the best is for us.